Hi, everyone. My name is Safwan Halaby. I'm a clinical associate professor of radiology at Lucile Packard Children's Hospital. I wanted to discuss one of our innovations in radiology, and I just have one disclaimer. I'm an advisor to Bunker Hill Health. So the assessment of pediatric bone age is usually performed with a single left-hand radiograph, frontal view. And you can see here that we typically look at the growth plates, the metacarpals, and the carpal bones, and compare it to a standard atlas, which is a little antiquated. So with the leadership of Dr. Larson on this Sentinel paper on using deep learning neural networks to assess skeletal maturity using these pediatric hand radiographs, we were able to build a model using deep learning that basically got to the point of being equivalent or better than a radiologist assessing the bone age. And you can see here with the saliency maps that the AI model was using similar locations to the standards that were used with human reviewers. And one of the benefits of this was a challenge that was posed to the public to develop a bone age model. And this turned into a winning model in this challenge from the 16bit.ai group, which many of you can try for yourself by just uploading an image of a hand radiograph, and it will give you the bone age assessment using their deep learning model. But I wanted to talk about our implementation of the model clinically here at LPCH. We, after IRB, data use agreements, consent, with the radiologist and developing the interfaces, workflow, and AI model, we created a randomized control trial that took an experiment group and a control group. So the experiment group where the bone x-ray was sent to the AI system and a automatic report was generated, which looked like this. So everything in red was automatically populated in the radiology report. It was reviewed by a radiologist, and I'll just show you just a quick example of what happens next. So the x-rays is in front of the radiologist. They initiate and launch the report, and everything is automatically uploaded based on the AI model. And then you get the impression here showing a chronological age, an estimated bone age, and then the standard deviation. We rolled this out at multiple children's hospitals across the nation, and they used basically the same model and tried it out. So establishing the gold standard is a bit difficult. So we had 4 radiologists review every exam. You can see here many people were involved, and there are too many people to really thank, but many sites were included and radiologists. So some of the takeaways is that we really need a layer of technical and legal infrastructure across institutions to support prospective validation of AI models at scale. So we need standards, data sharing, implementation, and clinical practice. And then for future work, we really need to look at AI solutions that address a significant clinical need. The technology must perform at least as well as the existing standard approach. Substantial clinical testing must validate the new technology. The new technology should provide improvements in patient outcomes, patient quality of life, practicality in use, and reducing medical costs. And it really needs to be a coordinated approach between multiple stakeholders. I want to thank the organizers of the Innovation Conference, and thank you for your attention. And I look forward to communicating with all of you in person. Bye-bye.